This program is brought to you by Whisper with Wings and Lactacid. Time check is now 8 in the morning. Ladies and gentlemen, our news anchor for today, please welcome DJ Me and DJ D. This is WZOB 106.9 News Radio. And now for the headlines of today's hottest news.
Kobe Bryant, pumanaw na. At mga mamamayan, pinag-iingat ni President Pangulong Duterte dahil sa pagkalat ng coronavirus. The country's hottest and sizzling issue, we give you the truth, nothing but the truth.
This is the program that everyone has been waiting for. Serving people, no bias, just news.
This is
WZOB 106.9 News Radio. What's up, what's up? Good morning, listeners. This is DJ Me.
Good morning, and to all of our solid kabalitaans, this is DJ D. All over the country, especially to our listeners na babae, may balak magbuntis or buntis at the moment, itong topic natin ay para sa inyo. And now, let's go with the details of our news or topic for today, which is preterm birth. As you can see, we have a very exciting topic which will be discussed by our special guest for today.
Oo nga, tama ka partner. Mukhang maganda nga yan. So today, we have Dr. Stephanie Menyo. So Doc, thank you po for sharing your precious time with us and despite your busy schedule. So, pwede niyo po ba kaming bigyan ng konting information lang about preterm labor to help enlighten our listeners?
Okay, so labor is when the uterus regularly tightens and the cervix starts to thin and open. So, this lets the baby or the fetus enter the birth canal. So, for most women, labor begins sometime between 37 and 42 weeks of pregnancy. So, labor that occurs before 37 weeks of pregnancy is considered premature or preterm.
So, yun pala ang tamang bilang ng preterm, partner, no?
Oo nga, tama. So, Doc, ano po bang pwedeng mag-cause ng preterm labor? Napipigilan ba to? Or may gamot kayang pwedeng inumin para hindi mag-preterm labor?
So, the cause is unknown in most women. Pero the known causes of preterm labor are infections, vaginal bleeding, hormonal changes, and stretching of the uterus. So, these might be from pregnant with more than one baby, a large baby, or too much amniotic fluid.
So, ayan, malinaw na malinaw. Mag-ingat tayo dahil pwede palang mag-cause nito ay infections.
Partner, no? Nag-i-stretching pala ang mga uterus nyo, no? In fairness. So, Doc, so how can a pregnant woman know that she is experiencing possible preterm labor or ano ba yung mga sintomas na dapat nilang malaman?
So there are, this is the most common symptoms of preterm labor, tightening of the uterus or what we call contractions, and it is especially for more than 4 in every hour. There is also a menstrual type ng cramps and pressure in the lower belly, backache, diarrhea, and change in the type or amount of vaginal discharge, and this might be blood, mucus, or watery fluid. There is also a gush of fluid from the vagina. So if you have symptoms, any of these symptoms of preterm labor, I would suggest you call your healthcare provider as soon as possible.
So, ayan mga listeners, huwag kayong magdadalawang isip na magpa-check up dahil delikado yan.
Tama. So, dapat yung tandaan yung mga binanggit ni Dr. Steffi, So, thank you po, Doc, Okay, bago po ang lahat, magbasa muna tayo ng mga tweets mula sa ating mga kabalitaan. So, partner, mukhang para sa ito, every day, I listen to your radio station. It is so good to hear the fresh, the hottest, and the most reliable news ever. Wow, thanks for that compliment at Daniel Padilla.
Daniel pala galing yan.
Yes, so we have also, sorry partner So we have also thousands of comments in our Facebook page.
So, ito mukhang para sa iyo to, partner. Galing kay Ivana Alawi. She says, "Good morning, WZOB. I really love this radio station. The DJs were so good. News are always fresh and best to rely on. We have also heard from our queen itself, Catriona, on Facebook. Grabe, mabenta ka ha, partner.
Puso to mga kabalitaan sa.
Sabi niya, "Hi Idol D, super love your radio station. I always listen to it, especially your reproductive health topics." Pati pala yun, nakikinig siya.
Siyempre, partner, updated sa akin. Topics kaya kami.
Talaga ah. Super thanks, more power, and continue helping and educating the people.
Wow! Thanks Ivana and Queen Catriona itself. So, that was very touching. So, kabalitaan. So, keep sending us your messages. All of you, you are the reason for energetic service here.
Okay, mga kabalitaan, it is our pleasure to hear your comments, suggestions, or any reactions. Like us on Facebook, facebook.com/WZOB106.9, or you can add and chat me and search me at DJ Me on Facebook and Twitter.
And add me, Dale Borta, on Facebook. mga kabalitaan sa.
You can also follow us on our Twitter. Click on twitter.com/WZOB106.9, or you can also tweet me with at DJ Me and DJD for Twitter. Or search Dale Borta on Twitter din daw.
Alright. Then, WZOB 106.9 is back. So, thank you for patiently waiting, Doktora. So, most women have preterm labor, right? So, we have a caller here from our med students says na, what are the risk factors of preterm labor?
So the common risk factors for preterm labor are smoking, being under
paninigarilyo.
smoking.
Partner, tigil mo na yan.
Naku, partner, bakit ako?
Also being under 20 years or over 35 years old of pregnancy. Also pag using illegal drugs such as cocaine, abnormally shaped uterus, cervix that are not able to stay closed. If the woman is stressed, under stress, yes, common ang preterm labor sa kanya. Having a preterm birth in the past or na-history siya ng preterm birth, placenta that separates from the uterus early, placenta in abnormal position, placenta that does not work well as it should, and early breaking of sac around the baby or premature rupture of membranes. So the risk of preterm birth is 12%. So it is one of the most common and serious problems facing women and their doctors today. So knowing if you are at risk and getting early prenatal care for proper treatment and monitoring can help lower your chances of early delivery.
Okay, mga kabalitans, nadinig niyo mga sinabi ni Doktora. Napakahalaga ng mga impormasyon na binigay niya po sa atin. So, Doc, so can you further explain yung mga contributing factors na nakaka-affect po sa pagtaas ng bilang ng preterm birth po?
For example, if the woman is currently pregnant, no? If she is having twins or triplets, preterm labor occurs in twins and triplets because of larger uterine size, cervical weakness, growth abnormalities, and complications with the placentas. Also, if she is having a vaginal bleeding in the first and second trimester is associated with an increased risk of premature birth. So the risk is actually higher the longer during the bleeding lasts. So the what we call the placenta previa and placenta abruption are risk factors for early delivery in the third trimester. Also, there is also lifestyle.
Mga kabalitan take note of this.
Sa mga patients natin na may weight changes or mga female na obese na pregnant, women with the pre-pregnancy weight under 100 pounds or over 250 pounds are at increased risk for preterm birth. So in obese women, it is often from complications related to high blood pressure and diabetes, but these women are also at increased risk of premature rupture of membranes. So too little and too much weight gain during pregnancy is also a risk factor for preterm birth.
Okay, Doktora. Napaka-detalyado ng pagkakasabi ni Doktora. Ewan ko na lang sa inyo, kabalitans, kung di nyo pa nakuha yun. Kundi, ay nako. No, partner?
Oo nga. Thank you so much, Dr. Nemenyo, for sharing us information about preterm labor. So,
that concludes our business for today. So, this is DJ D.
And this is DJ Me.
We are the WZOB 106.9 News Radio. So, partner,
Be with us again tomorrow, 9 a.m. for another parade of health topics, the country's latest news, the globe's hottest and sizzling news. We give you the truth, nothing but the truth. The news program that everyone has waited for. Serving people, no bias, just news.